your knee pain has been hurting for a while, I bet you try to understand what it looks like inside. What is it composed of? What bones make a knee? Structures, ligaments, menisci, what does it all mean? How does the arthritis happen in the knee? And how are the pain signals transmitted from the knee to our brain? Let's get right to it. So this is our knee model. This is the top bone here called femur that goes to the hip. That's the bottom bone that goes to the foot. There's a side bone here. And on top of that bone, there's one more bone that makes a knee joint. It's called the kneecap. And it slides, as you can see, on top of this femur bone. Now, the top and bottom bones have two compartments on the inside and the medial compartment on the outside, the lateral. So they're kind of like two knuckles over here. So that's how they're different, because they're not kind of flat on flat. They're two knuckles on top of the bottom bone. So these are the two compartments. And if you heard the term of tricompartmental osteoarthritis, that's because the third compartment, these are the two, and the third one's between the kneecap and this top bone here, the femur, how it slides and it hurts as well. Now we know the bones of the knee. Now here are the ligaments. Over here, this thing, it isn't not a ligament, it's actually your quad muscle, a very, very strong, big muscle of the thigh in the front. And it becomes a tendon right here. It grabs the kneecap all around and becomes a tendon right here and becomes anchored to what we call tibial tuberosity. That's where it ends. It anchors in right there. Now on the sides, there's the LCL, the lateral collateral ligament, and the MCL, the medial collateral ligament. These are the ligaments that prevent the knee from buckling to sides. In addition, on the inside, you have two inside ligaments of the knee, the ACL and the PCL. And what you are seeing here, the blue structure, which isn't really blue, on this model it's blue, is the cushioning in between the top and bottom part of a joint that absorb the shocks and create smoother movement. And with time or with degeneration, with knee being used up, these tend to fragment itself, break down, or even break off completely. And if we want to put this knee against a regular human knee, this is what it would look like. This is the kneecap right here. This is the bottom bone line, just as you see it here. That tendon here would be exactly here, and it anchors to your bone right here, just like that screw over there. And if you see this part has this round, the top bone is round, just like here, and the bottom is straight. On the side, it's kind of a similar thing. If we use the needle to inject the knee without ultrasound, this is a perfect space on the outside or on the inside. Now, what happens if there's arthritis in the knee? That cartilage and that menisci, the cushioning, disappears, breaks down, and the knee space between the top part and the bottom becomes closer and closer to each other, until at one point on the x-ray, you will see is as the top bone sitting on top of the bottom bone. That's exactly why we commonly call it bone-on-bone arthritis. And with the bone-on-bone arthritis, the cartilage gets used up, but interestingly, the cartilage wearing out doesn't hurt. The cartilage doesn't have any nerve endings to send and transmit pain to the brain. It typically creates an inflammatory reaction that sits inside of the knee, and the majority of the pain signals is collected by the knee capsule as this sac that contains all the knee with the fluid in there, and that sac wall transmits the signals through the nerves to your brain. And now if we have this knee shown to you like that, that capsule will just be over here between those two bones, going up between the kneecap and the femur, creates a bit of a sac here that we often see in ultrasound. When we inject with ultrasound guidance, that's where we go, because that's the most visible fluid sac of the knee. And it goes back and wraps around the whole knee, creating a closed environment where the knee fluid lives and creates an environment for the bones to move smoothly. So that would be the basic of anatomy for the patients who are interested in seeing how the knee works. If you are interested in knowing about non-surgical options for knee pain you can call my clinic, Landmark Knee, at 313-992-8088.